Okay.
Mr. Wickert, I noticed you're having some trouble walking here. I'm going to just place you down. Okay. Take my little wipes. I'm going to perform a neurovascular assessment on you. I see the CNA has already taken your vitals, so I'm not going to redo that. Although it's kind of tight. So, I'm going to ask you a couple questions. It may sound kind of funny, but just to make sure your mental status is okay. You know where you are?
Yes, doctor's office.
You know what time it is?
It is 12 o'clock.
12 o'clock. Do you know what day it is?
Monday.
Monday. Do you know what the President of the United States is?
Yes, Obama.
Oh, fantastic. I'm going to check your pupils here. There. Good. I'm going to check this one as well. Good. Okay, can you focus on the point of the wall for me?
Sure.
Check. Good. You just follow my finger. Fantastic. So I'm going to check inside of your. There's no obstructions. Can you open your mouth for me? Also good. Check your pulses, please. Match what the CNA has. Fantastic. Are you in any pain?
Yes, actually.
You are?
Yeah, my knee is killing.
Does it radiate anywhere, or is it just in the knee?
It's just, I've never felt this kind of pain before.
Okay, so,
It's weird.
okay, fantastic. I'm going to go get the doctor, and he will be right in to come see you.
Okay.
I'm the doctor, and I'm going to clean my hands again. Well, for the first time, because I'm the doctor.
That's right.
Okay, and I'm going to put on some more gloves.
How you doing, doctor?
Hello. So, what brought you in today?
Well, this pain in my knee, and I'm really tired.
You're really tired.
Really tired.
Fantastic. So, do you have any family history of any problems like this?
Well, my uncle, he had osteo something. It was a cancer.
Osteosarcoma? Well, that is a cancer, but bone cancer is quite rare. It can be malignant or benign, and either way, it destroys normal bone tissue and compresses healthy bone tissue. So, can you tell me some of your symptoms, some of the manifestations?
I'm tired.
Tired?
And my knee is like really swollen.
Swollen knee, trouble walking?
Yeah.
So you've been limping around kind of?
Yep.
Fantastic. Some of the other etiologies, have you had any weight loss recently?
Yeah, actually.
I
thought that was my diet.
Just really?
Yeah.
Exercising?
I thought so.
We haven't been walking much of that
No
lately.
pain, no gain, right?
Fantastic. So just swelling, pain,
Yeah.
tenderness at the site? Okay,
So.
well, some of the diagnostic studies we're going to perform, since we do believe that it's bone cancer, or it might be, we're going to perform an x-ray, and it can show us the size and location and shape of the tumor. Some of the x-rays we perform will be a bone scan where we inject radioactive material into the blood. It'll collect in the bone, and it'll show us exactly how big your tumor is and where it's located. We can also do a CT scan, which will just show us a section of the bone. An MRI, which will use magnets. Do you have any pacemakers or any kind of metal plates or anything?
No.
So no past surgeries that would prevent you from having an MRI? Fantastic. Also a PET scan, where they inject radioactive glucose into your bloodstream, and it will collect at sites where cancer is, because cancer cells use more glucose than actually regular cells. So that'll let us know if they're cancer. Also, we'll do a blood test today before you leave, and look for an enzyme called alkaline phosphate, and large amounts of this will collect if the bone is growing too fast. But have you broken any bones recently or anything like that?
No.
Because this will also collect if you've broken a bone or anything like that. So you don't want to. We don't want to collect too much to see or get a misreading on that.
Oh, sorry.
Yeah, but the only definitive way to make sure that it's a tumor or whatever it is a biopsy.
What does that entail?
The biopsy entails us actually going in there and taking out a piece of the bone tissue. If we do that, then we can tell if it's a primary tumor or if it's come from somewhere else and just started there. So we'll be able to see that if it's benign or malignant. Also, we'll be able to tell what kind of cancer it is as well. So that's.
It might not have started there?
It might not have started there. It might have moved from anywhere else in your body. Cancer can, if it's malignant, it will just move throughout the body. We're hoping that it's a primary tumor, but if not, we have to treat with a variety of treatment options. And let me tell you about some of those. Chemotherapy. Obviously, you've heard of it. A lot of people have heard of it.
Yeah.
For bone cancer, it's a 5-week cycle. On the first and second week, you take something called cisplatin as well as doxorubicin, and those are for 2 weeks. For the rest of the thing, for the rest of the treatment, you'll take methotrexate as well as folic acid or folinic acid in between there.
Do I do that at home?
You can't do that at home.
I can't.
You have to be in the hospital. They will let you go home for a little while, but when you go home, you're going to have to be at a risk for infection. And since you are on chemotherapy, you have to have blood tests, and they want to give you intravenous fluids to make sure that you're actually flushing some of these chemotherapy drugs out, because it's very hard, very harmful in the body. You'd be fatigued, you'd be tired, you lose your hair. It's really kind of a serious treatment. But the nurses will be there. They will give you further teaching. They'll help administer meds. They'll help you with your daily livings, brushing your teeth, shaving, things like that. And nurses will also be there to monitor your vitals and make sure that you don't enter any kind of distress while you're on these chemotherapy drugs. That's why you have to be in the hospital, so the nurses can do all these things to monitor and make sure that you stay safe while you're on these drugs. Also, there is the surgery option where they just go in and they remove the tumor. And we just go in, and hopefully if it's a primary tumor and benign, we just take it out and you're done. But if you get surgery, if you do any of these, you have to come back for a biopsy, because biopsy is the only definitive way to make sure that the cancer has been removed from your body. There's also a chance that we can do cryosurgery. We inject liquid nitrogen there to freeze and kill the cells, as well as radiation therapy, which is in the same way as chemotherapy, makes you weak, makes you tired, and you get sick real easily. Sometimes radiation therapy is used in combination with surgery. So, do you have any questions for me for the possibility? We see we get this taken care of, we get some of these diagnostic studies done?
Yeah, you said that there's going to be another biopsy? That's how I know that it's gone?
Yeah, you have to have a biopsy after the surgery, because the biopsy there to prove it's there, and the biopsy the second time will be to make sure that all the cancer is removed. Cancer will grow back. So if it's a possibility that you could have it again, and we have to do chemotherapy again, and we have to do surgery again.
Okay. And today we'll start with?
Just today we'll just do the blood test.
And then we'll move on from there?
Yeah, x-rays as well as biopsies and things like that to schedule.
Okay.
So, we come here today and we see you obviously have a problem. We want to make sure what it is before we move any further. And if I could help you with anything else, I will come back and I'll send the nurse back in to make sure everything got cleared up.
Okay, very good, thank you. I hate waiting in the doctor's office.
Hi.
Nurse.
I am your nurse. So, did the doctor help clear everything up for you?
Mostly. I do have some questions regarding home.
Home?
Yeah. She said for the chemotherapy I'm going to have to come in, but then I'm at home. I watch my grandchildren during the week. Is that going to be an issue?
What'll happen is while you're on chemotherapy, your immune system will be suppressed. So children, large crowds, and things like this are something you're going to want to avoid. As well as the fact is you want to stay around the center where you'll be receiving chemotherapy because you will have to come in for regular blood tests. The chemotherapy drugs want to be monitored to make sure they don't become so toxic they actually do more harm than good. The idea is to kill the cancer cells before they kill the rest of your cells as well.
So if I understand this right, the cancer may have started in my knee. If it is cancer and it may have started somewhere else, will these tests show if it started somewhere else?
The biopsy is the only way to tell if it's definitively that it started there. The other test will tell us if it's a tumor or not, but the biopsy will tell us if it's malignant, benign, and which kind of cancer it is. So, sorry to hear about this, but we're going to do the best that we can and provide the best treatment available.
Guess that's all I can ask for.
Fantastic.
Thank you, sir.
Thank you.
Dr. Fernandez and I would like to know what's the only definitive way to diagnose bone cancer. Question number 2, how many weeks is there in chemotherapy cycle? And question number 3, how can you tell if the cancer started in the bone? Good luck.
Fantastic.
Fantastic.
Yeah.